Assalamu alaikum, my lovely nurses. I hope you are all fine. So today our topic is ventricular tachycardia. Ventricular tachycardia. So ventricular tachycardia, the VTAC occurs because of repetitive firing of an irritable ventricular ectopic focus at a rate of 140 to 250 beats per minute or more. So if the heart rate is 140 to 250 beats or more, that is ventricular tachycardia, that is occur because of repetitive firing of an irritable ventricular ectopic focus. So that is ventricular tachycardia. There are two types of this ventricular tachycardia. One is stable and one is unstable. Mean stable clients and unstable clients. Stable with pulse, unstable no pulse. No pulse. What are the causes? Causes of VTAC: myocardial ischemia, or MI, myocardial infarction. Electrolyte imbalance, digoxin toxicity, stimulants. What stimulants? Like caffeine and methamphetamine. In yesterday I give one lecture. I told the methamphetamine with the doxymethamphetamine is a combination of medicine that we are using for the awake and the sleep for the pattern. No, that this is the combination of medicine. That medicine also creating the VTAC. Now the VTAC, as you can see in the picture, the VTAC, the strip, this is the rhythm. The rate is 100 to 250 beats per minute. The ventricular tachycardia. The rhythm is regular. P wave not visible. If you see the strip, there is no P wave. PR interval no, there is no PR interval. QRS widen more than 0.12 seconds. The normal is 0.6 to 0.12 second QRS. If we will see in the picture, the QRS is wide. There is no PR. there is PQ, the QRS is there. There is no P wave. There is no PR interval in the VTEC. What is there? Only QRS is white and the rhythm is regular, 100 to 250 beats per minute. Maybe this is more than. This is the ventricular tachycardia rhythm. What is the sign, symptom, or you can say manifestation? The patient is usually awake, unlike VFib. Unlike VFib, patient is mostly awake. Chest pain, lethargy, anxiety, syncope, and palpitations. This is the manifestation of the ventricular tachycardia. Now, what's the treatment we will do? Treatment for the VTEC. So, there are different types of treatment. If the stable client with the pulse, first we will discuss stable client with pulse. So, stable client with pulse, what we will do? We will give oxygen and we will give anti-dysrhythmias, anti-dysrhythmics medicines. For example, amiodarone, and what is our priority? To stabilize the rhythm. So this medicine, anti-dysrhythmias, what they will do, the medicine stabilize the rhythm. Number 2, synchronize cardioversion. Synchronized cardioversion. What is synchronized cardioversion? The synchronized cardioversion is synchronized administration of shock delivery in sync with the QRS wave. So keep in your mind the cardioversion, the synchronized cardioversion. The cardioversion is not a defibrillation. Cardioversion is not a defibrillation. Defibrillation is only given with deadly rhythm, no pulse. So defib only for no pulse patient. The unstable clients. In the stable client, we are giving synchronized cardioversion, and in the non-pulse, the patient don't have pulse, we are giving defibrillation. Now the unstable clients without pulse. If the patient don't have pulse, what we will do? We also telling this one pulseless VTEC. We also telling this one, the unstable client without pulse, the pulseless VTEC. What is the treatment? CPR, cardiopulmonary resuscitation, follow ACLS protocol, like shock, the ACLS protocol for defibrillation, for the we will use ACLS protocols. Intubation possible intubation, and drug therapy. What drug therapy we will use? We will use epinephrine, vasopressin, and amiodarone. One thing keep in your mind, if we did not treat the VTAC, untreated VTAC can lead to ventricular fibrillation. If we will not treat VTAC, what will happen? Go to VFib, and VFib is totally no pulse. In the VFib, no pulse. So patient will go to more critical condition, and what will happen? Death. One more important thing, the primary healthcare provider may attempt cuff cardiopulmonary resuscitation. This one also we are telling CPR, but this is not cardiac pulmonary resuscitation. This is not cardiac pulmonary resuscitation. This is cuff cardiopulmonary resuscitation. The primary health care provider may attempt cuff cardiopulmonary resuscitation. What is cuff cardiopulmonary resuscitation? The doctor will tell to the patient to cuff hardly every 1 to 3 seconds. 1 to 3 seconds. That is cuff cardiopulmonary resuscitation. The doctor will tell to the patient to do the cuff cardiopulmonary resuscitation for every 1 to 3 seconds, the hardly cuff. So that is ventricular tachycardia. I hope you like the lecture. If you like, please share, subscribe my channel, and don't forget to push the bell button so you can receive my coming videos notification. Take care yourself and your family. Allah Hafiz.